everybody. Clearly have not gone to the Tony Preckwinkle School of Greeting here. Good afternoon, everybody. There you go. All right. Thank you. Welcome to this afternoon's conversation. We were focusing on the safety net in our communities. For that, as president of the Chicago Community Trust, this is one of the priorities that is near and dear to our funding and our mission to support strong, resilient, prosperous communities in metropolitan Chicago. We see this through the frontline work of hundreds of nonprofit organizations that daily are grappling with a reduction in resources, while the demand seems to continue to escalate more and more and more. Over 600,000 individuals utilizing nutrition programs in our region each and every day. We see the impact on foreclosures. We see the impact on access to health care. We see that in the increased poverty numbers that came out from the American Community Survey results that have come out from the Census Bureau. The numbers continue, even though on whole our economy has been rebounding from the Great Recession. We have an opportunity now to explore these issues in depth. For that end, it's a little ironic, I think, that the competing panel is focusing on pensions, which are going to complicate the challenge of maintaining or rebuilding a social safety net. We are fortunate to have a panel of brilliant people. That is about the extent of the introduction. You've got information about them in your materials. And we are very fortunate that Margaret Ware from the University of California at Berkeley undertook to provide a framing paper for this discussion, laying out a very interesting typology and analysis for us as a starting point. And so I will ask Margaret to begin. We will then have further comments from each of our panelists for that, and then we'll go into an extended conversation to pursue the ideas issued or that are raised, and then making sure we have at least 20 minutes or so to include and respond to questions here. Because of the crowded nature here, we cannot have individuals moving around to collect your question card. So the strategy that was recommended to me was that simply pass your questions along. They'll end up dumping into the chasm in the center here. They'll be picked up efficiently at that point and shared with us the rest of it. But we are time pressed because of the opportunity for Secretary LaHood to speak at 3 o'clock and honor that commitment. So without further ado, let me ask Margaret to frame the questions and issues for us.
Let me say, first of all, it's a great pleasure to be here. I went to graduate school at the University of Chicago, so I'm always happy to come back to the city of Chicago. And it's a pleasure to be here at UIC. My charge was to write a paper about how local governments provide for the health, safety, and welfare of their residents. And so when I started off the paper, my initial argument is that that is not the thing that is utmost in the minds of local officials, how to prepare for the safety net. And listening to this morning's panels, all about legacy costs, all about economic development of downtown, all about getting people to live downtown, issues about the safety net, about social welfare of less well-off residents, it's just not in the minds of front and first in the minds of public officials. And most of the safety net, of course, is paid for by the federal government and the state government. So the question is, what is the role of local government? What kind of role could there be? So I surveyed a lot of literature, and it seemed to me that local governments have played 4 different roles when it comes to the social safety net. And the first one is that of connector, connecting people to federal benefits that exist. taking up the earned income tax credit, having campaigns so that people know about SNAP benefits. Chicago was a leader in one of those campaigns about take-up of SNAP benefits, but there's still a number of cities, and particularly places with large numbers of immigrants, where there is low take-up of SNAP benefits, about 40% in the city of San Diego, for example. So connecting people to the benefits that they have through public outreach is one critical role that local governments play. The second one is that of system builder, and everybody here knows probably more than I do, most social welfare benefits are delivered not by government alone, but by some combination of nonprofits, government, some private entities, and they're often pretty uncoordinated. And especially in a time of fiscal stress, but even not in a time of fiscal stress, you want to make the most of your benefits. So local government's second role is that of system builder. And local government has a microphone that it can project out. It has tentacles into different parts of the community. So it is well situated to play that role, if it tries to play that role, to bring together something to make a system, make a bunch of uncoordinated pieces of programs into something that operates more like a system. The third role that I talked about is that of program innovator, and a lot of cities don't take on that role, and tends to be the more some of the richer cities that take on the role of program innovator. So, for example, the city of San Francisco, which is a quite well-off city, created a program called Healthy San Francisco, which is a health access program that provides health care to all residents of San Francisco if they don't have health insurance. And it's funded for by a tax on employers who don't provide health insurance to their employees. But there are smaller ways that cities can do innovation. Philadelphia has had a program where it doubles the amount of money that people can spend at farmers markets, for example, with their SNAP benefits. It adds another increment onto that. So looking for ways to innovate. And when the city does it, it adds that extra weight. When the local government does it, it adds that extra weight. And the final role that local governments can play is that as advocates for low-income communities and for the needs of low-income people, advocates at the national level and at the state level. And this used to be a really big role that local governments played, and I think that role they have backed off from that role. So, for example, things like extension of the TANF emergency fund, which provided jobs for people who were on assistance, was something that expired with the end of the stimulus. That's the kind of thing that would really help low-income residents, that could be a focus of advocacy at higher levels of government. But let me say, since I see I have 1 minute left, so I distinguish between the local governments that are actually have played these roles or are trying to play these roles. But then I said, there's actually two other kinds of local governments. And what they do or don't do actually affects the governments that are trying to do things. So in addition to this engaged set of governments, there's a set of governments that I call the weak local governments. And those are places like very poor suburbs that really don't have the capacity to play these kinds of roles. So you see them in the south part of South region and the western part of Chicago. Cities across the country have very poor suburbs with very little capability. And the question is, what should happen in those places? What's the role for philanthropy? What's the role? How can those governments be strengthened? We're not going to reinvent community development in those places. What's the strategy? And my last one, even though my time is done, is we also have a class of local governments that I call the avoiders. And they both try to get low-income people out of their communities if they happen to come into their communities. They try not to provide any services because they don't want to attract low-income people. They create all kinds of, they put the burden on the places that are providing benefits. So the question is, what are some of the ways that the avoiders can be made to participate in what is a regional task of bringing everyone into a growing economy and providing opportunity for everyone?
Thank you, Margaret. That's a very helpful framework to look at this. Nick, your thoughts?
Sure. we often think about these issues as questions of social assistance and a social assistance question, but what I'd like to do for the next 3 minutes is to think about it a little bit as an economic development question. So back in 2006, again, as the economy was recovering from the previous recession, we did a quick study looking at public assistance payments and take-up rates in Illinois. And at that time, we found that there were 475,000 families in Illinois with a year-round worker. So 475,000 families with at least one person in the family employed all year round that were receiving public assistance in Illinois. We're talking about TANF, Medicaid, Earned Income Tax Credit, Kid Care, and food stamps. This group represented 37% of all public aid spending in Illinois. So the problem for these families is a problem of low wages. 2/3 of those families had workers earning less than $10 an hour. And at the time, we framed this as the hidden public cost of low-wage work. When we looked at the sectors where these workers were employed, they're the big growth sectors: health, retail, hospitality, the very sectors that many local governments are saying we need to bring in to shore up our economies. And interestingly, 1/3 of those workers work for employers that had more than 1,000 employees, right? Big firms. 1/3 work for firms with more than 1,000 employees, and another 21% work for firms that have between 100 and 999 employees. So we're not talking here just with mom and pop stores trying to make a go of it. We're talking about some of the largest corporations in the country. Now, these social assistance programs are absolutely crucial supports for Illinois families that are in need, and they contribute to the high quality of life that we all enjoy here in Illinois. But their purposes are being subverted. When profitable companies fail to pay family supporting wages, they push their costs onto these programs and onto states and onto local taxpayers. The hidden public costs of low-wage work are an important subsidy, I would argue, to these employers. So please, just in the last minute I have, play along with me for a moment. And let's think about what it might mean to view these strong safety net programs through an economic development lens. In the previous panel, Rachel Weber said she envisioned a time when economic development incentives would be used smarter, more creatively, more strategically. And I think she framed it both as a question of design, but also one of political will. When local governments use economic development incentives to subsidize low-wage employers, two things happen. First, we often subsidize businesses that probably would have come here anyway. Make no mistake about it. The big box stores need big cities like Chicago because they are home to a big consumer base. And the second thing we do, so there's an economic inefficiency to that kind of subsidy. And the second thing that we do is we support businesses that are going to be employing workers who must draw on these crucial safety net programs and often draw on them in an ongoing basis. So in this sense, the public sector pays twice. So let me leave you with this thought, since it looks like I'm out of time. In the timekeeping, I'll assure you, it's ruthless up here. If firms are going to come to the public sector and ask for subsidies and ask for these incentives, we need to, I think it's incumbent on cities and the general public to understand what they're investing in. This is what Rachel was talking about, being smarter and more strategic. We need to understand what we're invested in. But the last big box debate over the big box ordinance here in Chicago revealed what I think is a real problem, and that is a reluctance on the public sector to have a discussion of these wages. And I think because of that reluctance, our economic discourse suffers a great poverty because of it. Thanks.
Great. Thank you. Rachel, your thoughts?
So as a social scientist, what I think about is the interlocking context that surround families and children, and the safety net is one of those contexts. And in reading Margaret's paper and thinking about her typologies, what I realized was that we know a good deal about how that social net supports families and also where its holes are and where it breaks. But we don't know a lot about how living in particular municipalities matters for children and families' well-being. I thought about one long-standing interest of mine, which is really how a family with particular characteristics does when they live in other communities that have people like them or not. So a poor child living in a community of concentrated poverty, we all think of particular disadvantages with that, being exposed to crime, having under-resourced schools. But we don't think as much about how a poor child living in an area with few poor children may have some disadvantages. And that is due to the lack of supports, the lack of the safety net that we're talking about. And I recently saw this in some research that I did with colleagues about the food subsidy program that's used in child care centers. And what we found was that a poor child was less likely to receive that subsidy if they were living in a more advantaged area. So about 2/3 of poor children received it when they lived in the poor zip codes, but just 1/3 of them did if they lived in an area that was relatively well off. And this is an important area for research to think about, but it's also an important policy topic because we know there are communities that are changing with new pockets of poverty. And so we can think about how those families are doing. We recently talked to child care center directors in Chicago, and what they in fact told us was that some of them weren't enrolling in this program because there weren't enough families that qualified and the paperwork was too burdensome for them. So those poor children were missing out because that federal dollars flow through the provider, for which there weren't the right incentives and resources to sign up for the program. So thinking back to those typologies, I think there's many ways in which we can think about how municipalities could connect those directors to more information. They could build the system to help support them. There are, I think, innovative ways that they could, for example, have a staff person that could go around to different centers so that they're sharing the burden of the person to do all of that paperwork. There are also ways that they can advocate. In this example, license-exempt providers are not eligible in most states. That's an important family daycare resource for many families, and in some municipalities it's going to be a big part of that child care infrastructure, and so they can advocate for those federal dollars to go to those families as well. So I saw lots of opportunities for new work and new ideas with that typology.
Okay, thank you. As we've seen an era post-Great Recession with government stepping back or simply not having the means and a failure of some market mechanisms, philanthropy has been called on to step up and fill the void for that. Not every city has a sizable foundation of the magnitude and creativity of the MacArthur Foundation. So in metropolitan Chicago, we're very blessed with that resource, and leading the domestic programs is Julie Stash, who can provide another lens by which we look at the issue of the safety net and the challenges in our community.
So thank you, Terry, but also a proud grad of UIC, so it feels good to be here. What I'd like to put on the table is a challenge to all of us to think a little more broadly about the social safety net and to think about whether or not there are ways to address its strength or weakness by pushing on levers that are actually outside of the purview of the traditional arena of health and safety and welfare. And here I'm talking about housing. Now housing, of course, I see Raphael Bostic says yay. So when I'm talking about housing in two ways. First of all, I'm talking about housing, the stability or instability, the cost or affordability, all the attributes of housing, its condition, its location, and whether or not there are things that can be done to address those that have an effect on either increasing the pressure on the safety net or decreasing it. And so we're funding a large body of research that says, not is housing good? Yes, okay, you don't need research to say that. Is stable housing good? But what attributes of stable housing? What kinds of subsidy? Subsidy when is it available for a family? Only at the time of a young child's presence in the household? What are the different attributes? And what are the effect of supporting and subsidizing people at those times with those attributes that can play out in the mental health, in the attachment to the workforce, in the school achievement, in the adult general health, all of the things that sometimes actually play out in pressure on the safety net. So if you move upstream a little bit and say, what can we do to help make sure that people have housing that is affordable and stable, thus removing that from the equation as a variable, what can we do there that diminishes the effect on the safety net? I mean, some of the things that a government could do, and this might bridge over into economic development, not the mega economic development, but local economic development, because housing development is in and of itself an economic development activity. When you think about a municipality can devote some of its resources to make sure that there is adequate affordable housing. At the same time, it can have policies that say, how do we want to work with banks and others to diminish the likelihood of foreclosure? Because some research that we're funding is actually pointing to the conclusion that foreclosure is a big factor in the instability of housing, and when people are worried about it or actually affected by it, then the likelihood that they're going to need the help that is available or not through local organizations is greatly increased. So what I'm proposing is that when we think about safety net, we think a little bit beyond the traditional purviews of it and put housing in the equation for both its economic development potential, but for its ability to keep people out of the range of needing to tap into the social safety net.
Great, thank you. Margaret, do you have additional thoughts that you want to build on?
Yeah, I would actually just, based on what people said, I think this, what you just said, Julia, is exactly right on, and it goes on to your comments, which is that thinking of the social safety net by itself makes no sense, the traditional just health and social benefits, because what kind of wages are out there and possible for people to get matters a lot, whether they have affordable rental housing, which, by the way, would be a great thing for mayors to advocate for at higher levels of government, an affordable rental policy. And I would add transportation to that. I mean, I heard this morning about producing transportation so that there's bike lanes to Google. Well, what about transportation for people to jobs, from low-income neighborhoods to jobs? And so it does suggest that the problems that low-income people have are not the problems of low-income people, but they are the problems of the systems of wages, housing, transportation that have left them, created systems of opportunity that have left them with a lot less opportunity. So I think this idea of opening a purview of what we see as the safety net and understanding how other features of the of public policy and the economy, when in public policy, if you're talking about subsidies, are affecting the safety net itself.
I'd like to say that opening it up, it also opens the arena up for many different types of advocacy than just advocating for additional funds into traditional social service agencies and the services that they provide. Because what it says is there are a lot of people who can come around a single outcome, which is greater economic and social well-being for individuals. But they can work together, each coming from their own perspective, knowing that they have different levers, different champions, and different funding streams that they can affect.
I think this advocacy point is great because it's an opportunity here, if you look at the job and housing market, to be proactive. That we know that we have a housing affordability problem in the Chicago area, in the state of Illinois, and in this country. We know that we're in the midst of a foreclosure problem right now. There is a need to react to that and to look forward so that when the next recession comes, that we don't find ourselves in the same situation. We can say the same about job quality. We have a job quality problem in this country and in this city. And regardless of whether we're in an economic crisis or not, we've got to start to address those problems so that those safety net programs aren't unduly burdened when problems do strike.
Okay. So speaking of job quality, there's a concern of some unintended consequences of the Affordable Care Act. The issue of small employers stopping job growth at 49 employees, so it doesn't kick them into a new category. Are employers moving more to a temporary structure of employees who are working only 29 hours a week, and so they also fall under a threshold. So it could have the inverse impact on our employment and wage structure for that. Whether you want to react to that, Nick, or some other thoughts about what do we do to regain what we would historically consider good middle-class jobs and wage rates for that.
Yeah, I'm not an expert on the Affordable Care Act, and I know there have been these issues of threshold effects kicking in. I think time will tell, and we'll have to look at that, and there can be public policy fixes if those issues arise. But this is the law of the land now, and this is what we're going to be doing. You know, I think a lot of the questions that we're dealing with here, though, on the job side, are going to be resolved through open conversation and discussion, and that is something we really haven't had very much in this country about jobs. I think that my main concern here today is about state and local economic development programs that are geared toward attracting jobs. Understand that we need to have jobs in the equation, but don't factor in job quality into the calculus. And that if we don't hold ourselves accountable in the economic development field to job quality issues, we're going to end up paying for a bunch of unintended costs on the back end as families can't make ends meet.
I'd like to say one thing about the Affordable Care Act. I mean, I think everyone who's concerned about human services and social welfare should have their eyes on the implementation of the Affordable Care Act. I mean, it is going to create a lot of changes. It perhaps will create opportunities, but it will also create some challenges. So the systems that are getting set up to identify people and enroll people in Medicaid are going to have implications for human services. How can human service providers take advantage of that? How can that be an asset, a new set of new opportunities for human service advisors? It may also create new burdens on safety net hospitals. It's a wide open question what the impact of the Affordable Care Act will be if they reduce the disproportionate share hospital funds from the federal government. Will there be a crisis of institutions that actually serve low-income people and provide health care to them? Or can it be turned into an opportunity for kind of integrating human services and health care? But it's an example of new funding streams that are coming online and being aware that those new funding streams may present opportunities for human service providers that don't necessarily think of themselves as healthcare providers.
So, Rachel, you focus on a broader context. Anything in this conversation you want to
But I was just thinking as well, as we broaden this out, I mean, why not include education and early childhood education as well? That's the pipeline into getting people ready for jobs. And so I think we broadened it a bit. We can broaden it even further. That complicates the issue and the solution. But part of the challenges that we face are being too narrow in the safety net and looking at each piece on its own.
So a question for all of you. How many of you are working for or with a nonprofit organization? Just to get a mix here. Okay, so a fair number of people here. One of the insights that I got from your paper, Margaret, was this notion of advocacy, that you put it on the responsibility for the municipality to be the advocate. But what we've seen are municipalities are shirking that responsibility and are catering to a different audience. They're going more towards the wealth and the wealth builders, fueling cycles of gentrification, let's say, but not necessarily advocating for all of the residents who live there. So if we talk about, as a panel, the notion of advocacy, then we've got all of these nonprofit representatives here. Is there a role for the nonprofits to advocate with their municipal leaders for a certain posture, set of priorities, policies?
Yeah, I think in the end, it often does end up falling to nonprofit organizations, both to advocate at the city level and then to build coalitions to go to the state level. And I know that there has been some of that. I think you funded some of that to promote a consortia of nonprofits to go to the state to advocate. In a way, it does end up falling to nonprofits because they're the ones who are on the front lines. You're the ones who are on the front lines of trying to deliver these services with, when you don't receive your checks from the state government, there needs to be some responsiveness. But I wonder about the advocacy of just the nonprofit sector alone. How can that advocacy become stronger? What are some new kinds of coalitions that could be built and join with the nonprofit sector? And one example, of course, is with occasionally with organized labor, especially Service Employees Union. This has taken up the cause of low-wage labor, connecting with nonprofits, with advocates in other arenas, so with bringing advocates around housing together with those that deliver social services, so that some of the advocacy silos get broken up. Because one of the areas that's been cut dramatically in the federal government, I think they have the money for the community services block grant in the last budget, the traditional money for community action agencies, and they've had associations and lobbying for decades and hasn't been successful. So I think thinking about that advocacy and thinking about new sources of allies who may have access to other funding streams and or who may have access to other kinds of clout, like labor, thinking differently about who the allies are and what the funding streams are in that advocacy.
Well, I'd like to make a quick comment on that, and that is that no matter how strong everyone's advocacy is, there's not really enough money. And so I think it is incumbent upon advocates and agencies and organizations that fund them, but also organizations like my own that fund research, to really pay a lot of attention to the evidence right now. Because the evidence is what's going to make some advocacy stronger than others, setting aside political considerations, which I know you really can't do. But the fact is that if governments are going to be looking to pay for things that work, it seems to me that the strongest arguments are going to be about the things about which there's evidence. So it seems to me that the more we come together around programs that have been shown to work in the kind of research and demonstrations that we could tee up for research, the stronger the advocacy can be, but by the same token, the stronger the outcomes are going to be, because the fact is that every dollar spent on something that doesn't really work is a dollar that could have been spent to better use.
Rachel, you've done a lot of this type of research. Is there a body of research that you feel is as being underutilized that could be helpful in this type of advocacy?
Well, part of what I've experienced, there is a big push towards evidence-based decision-making and programs that's very important. What I wonder is if there's a disconnect between that knowledge and on-the-ground practice, and if we can help make some of those connections as well.
That seems like a really excellent point to me. I mean, some of the literature, for example, on workforce development makes that exact point, which is that the knowledge about what the proper programs are has totally outstripped the creating of the institutions on the ground. So you might know in the abstract what works, but how do you actually create those institutions that deliver the services that we know need to be delivered? And we now understand what kinds of programs might work, but how do you create the institutions that do it? And so, some of it is a matter of reorganize, especially on a constrained financial time. How do you reorganize institutions that are currently on the ground? Do we have too many nonprofits? And does there need to be some kind of consolidation? Do we need to think about new roles, for example, that you talked about? Do we need to think about someone who would go around to different kinds of child care centers and play that role of sign-up so that not every single child care center has to play it, but how do you rethink roles so that you're recreating the institutions in a way that is efficient, but allowing them to do something different than they've done in the past.
So actually, you talk about a two-step process, which is how do you get the research to the field, to the ground, and how does the ground take it and actually deliver it in either reimagined or entirely new organizations? It seems to me that there's another step, and that step is, first of all, how do you translate that research so anybody understands it? Now, that's not an anti-academic comment, but it is sometimes there's a disconnect between what a researcher wants to look at and what really is important at this moment to know. And so it seems to me that there's the possibility, a fruitful possibility of a closer relationship between people on the ground who know the problems today and public policy makers who have the ability to change what they're doing, and then researchers, so that researchers can know what is important to know, and that there's a policy customer for that research immediately.
You know, one of the things about research is that, especially in the field of social welfare, it tends to focus on these large data sets that are divorced from place and divorced from organizations. And it's people who run organizations that know how organizations work. And there's something of a gap in between the research that focuses on large data sets and can tell you what kind of programs seem to work, but they may not work. They may work in one context, but in every other context they're not going to work because you don't have that same set of talents, organizations connected to one another in a particular way that they seem to work in one place. I mean, that's a little bit the flaw with research with large data sets. It doesn't tell you how the organizations work and how they're connected, which is often the key to getting the result that you're looking for, that you're hoping to achieve.
Let me encourage people to identify questions. And if you do have a card with a question and want to move them to the center so we can pick them up, because there are a number of experts in the room here, and we want to engage with what's top of mind for you as well.
Can I add to the conversation? Because there's also opportunities for the connections you were talking about, and for research to be more ongoing rather than just a fixed time point where it's done and we learn something and then we go on somewhere else. But can we have more continual relationships between researchers and people on the ground and policymakers so that we're continually learning and changing? And that's an opportunity as well.
I was trying to think if there were a couple of things that you could suggest that one could suggest to governments that weren't about don't let the safety net fray or something like that, because that may not be what a government wants to hear, even one that's engaged. So I was wondering if there were two things that you could say could really be a good role for a government. And one is leave no dollar on the table. So if you leave no dollars on the table, the operations of that go to some of the things you're talking about, is to make sure that everybody actually, the high uptake on federal and other benefits. But it also goes to whatever programs across agency in the federal government or individual agencies have out there, go for every one of them that you can. So, and then the second would be do everything that you can as a government to diminish instability in housing. Because and then you figure out what causes instability in housing and you focus on that, then it diminishes the pressure on the social safety net.
And before we get to the questions, Margaret, in your paper you had laid out a series of recommendations. We've touched on several, the housing opportunities, the Affordable Care Act. Julie just brought up the federal benefits take-up rate. We haven't talked yet about the regional approach, and I know that it became very clear with the influx of immigration to the Chicago area in the 2000s that many new immigrants were bypassing the city center and moving directly out into the suburbs, where it was apparent that they were woefully unprepared, lacked the capacity to support the integration of new immigrants into their communities for that. So we did see that problem. We saw the challenges with the foreclosure crisis of the suburban communities, and we funded a couple of regional coordinators to bring together networks of small municipalities for that. But we're always challenged by this pressure to develop a regional solution to things. What are your thoughts of how we can move forward?
You know, regionalism was sort of the buzzword of the last decade. You know, everybody was regional. I was listening to the mayors this morning, they were all regional. And I sort of feel like regionalism turned into business development and marketing the region as a, you know, as a entity. And the kind of notion of something regional that had to do with, you know, human need, et cetera, got lost. And so I think we are far from having a good sense of how to have some regional approach to the issue of need. And it is true, you know, all across the country. In Chicago, the poverty level is now higher outside the city. Not the rate of poverty, but the poverty level is higher, more people in poverty outside the city than in the city. Other places, Atlanta, it is way more poor people in the suburbs than in the city. So thinking about how to deal with that is a huge issue. Some of it, I think, some of the kind of thing that you were talking about, Rachel, we need to think about institutions differently. So it's not a matter that you create one regional body and that's going to solve the problem. So there are examples of, can you create holistic kinds of community development and plop down in place a kind of multi-service center entity that provides a variety of benefits. There is an example in Houston of this neighborhood centers organization that is able to do that, and it has these sort of multi-service agencies that it's putting into places that have zero infrastructure. So I think thinking, you know, at a higher scale than we have been used to thinking, as you know, from community development, the way community development grew in the suburbs. So I think it's not about establishing a Chicagoland regional human services entity, but it's about thinking about new kinds of organizations and new kinds of positions that connect organizations and do functions differently, I think is the way to think about it. But I think it's a huge challenge because in places that don't, where there's no there, where there's no organizations and not very much capacity, it's really hard to do things. We did a lot of interviews in Atlanta and some in the Chicago area, and for when there's not much on the ground, it's hard even for philanthropy to come in. I know that you've created networks, but that was over a longer period of time. It doesn't happen automatically, and there's a lot of need in that time. I think it's a very, very tough problem, the regional issue. I don't think there's an easy answer to it. And there's a lot of avoiders out there in my typology.
Nick?
Well, you raise the issue of immigration, and there is the fourth category, the avoiders. And earlier this week on Monday night, I was in Phoenix, which in many ways wrote the book on avoiding. And I was observing a focus group of undocumented immigrants. And the story was a predictable one. Parents were not taking their children, even their U.S. citizen children, for healthcare checkups. There was almost no preventative medicine. They were afraid to do early childhood education programs and so on. Very expected. On Tuesday night, I was in Los Angeles, same story, in a focus group with undocumented immigrants. And surprisingly, the story was exactly the same. That and you cannot argue that Los Angeles is an avoider, but the message was being sent the same. And parents were holding their kids out of programs, afraid to go to healthcare and so on. So imagine, run this kind of program for several years. If you care about early childhood education, if you care about reducing poverty, if you care about reducing the instability and insecurity that so many families face, we've got to deal with this problem.
That leads to a question which was addressing how much does the concept of healthy homes and healthy communities affect the social safety net? So it is the integration, and perhaps is there a notion of by accessing services, you're preventing other types of problems?
Well, I think on the healthy home side, investments in healthy homes, in non-toxic environment, in materials and construction processes at the very core, diminish the likelihood that someone will need to tap into the healthcare system. And so these things become actually pretty distant from each other, but I think you can model the cost benefit of that kind of investment as it plays out over other systems, if we're willing to actually have the rigor to look at those cross-system analyses. So I definitely think that that is something to put into the mix. It's not a solution, but it definitely addresses it.
I would say about the cross-system mix, if you're doing any kind of healthy homes, that's building, and that's an opportunity for jobs. And that was supposed to be part of the stimulus plan, the whole weatherization program that really didn't seem to take off. Maybe it took off a little more in Chicago, but the idea that when you have some kind of programs that involve rehabilitation of housing, etc., it should also be building transit. It should also be an opportunity for providing apprenticeships and access to those quality jobs. And the mayor of Los Angeles did do this with they had this expanding accelerated plan for transportation, and they made providing jobs to people in low wage, low income zip codes within the Los Angeles area, making sure that they were part of that and they were guaranteed a certain number of the jobs. So thinking cross-system in that way about jobs too, I think is a critical piece of it.
So one of the challenges that we face is that the need for the funding is oftentimes upfront, but there are streams of public benefit revenues that come to that. So we have a question about social impact bonds as deemed as a new financing model to help to leverage private capital and bring that in to address these solutions. Julie, I know that you have been looking at this, and that the MacArthur Foundation has a history of program-related investments where you've put your endowed resources to work beyond your grant-making funds. You want to start off on a conversation?
Just a tiny little insight, which I did not realize at first, and then I had an epiphany, and then I got skeptical. So, and social impact bonds sound like a very good way to address the notion that money is not always available when it's needed to fund service. And so, so the idea is that you offer a return to private sector investors. But I think the thing that's not generally known is that somebody actually has to guarantee that return. And the guarantee is not from the service provider, the guarantee is not from the government, the guarantee is from philanthropy so far. And so the idea that the first social impact bond in New York related to, is it recidivism?
Yes.
Yes. So Goldman Sachs actually has come up with the money, but it is, it's almost 90% guaranteed by Bloomberg Philanthropies. So the idea is that actually the most effective way to bring private sector money into the social services arena. So I'm not saying it's not something that we should continue to look at, because we do have a timing gap with respect to money. But what are the guarantees? First of all, it's from philanthropy, and there are a lot of other questions there. Where is government's then accountability in actually devising programs that really work? Where does responsibility lie? And are we willing today to let responsibility devolve away from government? So I think there's a lot of questions there. It's still something to really be explored, though.
I would just say, I think that this point of are we willing to let responsibility devolve away from government is just critical, because one of the weak cities that I looked at in the paper is Detroit. Now, Detroit is kind of farming out a lot of its functions to nonprofits because it can't operate. But what are the long-term impacts of having government step away from having some responsibility for its lower income population? I mean, that is a terrible, a terrible way to think about what the responsibility of a city is. And things that get off the public agenda become lower down on everybody's radar screen. And I think it could become a way to just push it off to the side and no one pays attention to it anymore. It's like yet another arena where those needs receive yet lower priority. I'm happy to hear that you're skeptical of social bonds, because I see that there's this kind of latching on to it because people are desperate for revenue, but I think caution is in order. I don't think Goldman Sachs is going to save low-income communities.
Not unless someone else pays for it.
Any other thoughts on that?
I wondered if you had any thoughts on shining lights on the avoiders. I mean, we haven't talked as much about them, but is that a role that folks on the ground can play?
You know, I mean, one way that people have tried to deal with the avoiders is through things like inclusionary zoning, that there should be affordable housing spread throughout the region. And I know that there have been efforts in the Chicago area to have inclusionary zoning ordinances in Lake County and DuPage County, and they haven't yet gotten anywhere, and they were pretty mild ordinances. Preserving the affordable housing that is there, because the avoiders not only try to prevent people from coming in, they also try to actively eject the people that happen to have gotten there. The housing that they built in the 1970s thinking that was going to be full of swinging singles is now full of lower income families, so try to preserve that, I think, is one thing. You know, there's a lot of local autonomy, and it is hard to crack the local autonomy. It has to probably come from a higher level of government, the state level, and you know, I think it's a tough political problem. Where you don't see it is in regions like the Denver region. There actually is some pretty good cooperation around lower income communities that's regional, and it's in part because poverty just happens to be spread more throughout just the way that region developed. You see more poverty throughout the region, so lots of mayors throughout the region have an interest in thinking regionally about it. I mean, Chicago has made, given the problems with the autonomous, lots of local governments, Chicago's made some steps in this direction, I think, through some of the collaborations. But this is where I think philanthropy probably does have a role to play, and in helping identify those needs and making kind of connections between city agencies, city providers, and needs in other outside the city.
I think an example of that type of advocacy, our colleague foundation, the Boulder Community Foundation, since you brought Denver into the mix here, they had identified the need for funding for early childhood education. They had approached the county to see if they would agree to a village increase to fund that program. The county turned them down, so they went to the school district that was proposing a bond, and they got an agreement that a portion of that bond would be earmarked for early childhood education. And they were successful collaborating with various interests to get that passed in a state that does not like to tax itself for that. And so I think that there are ways, maybe more targeted and specific, to address some of these needs through a collaborative approach, that we can't do it on our own. The converse of that is I think avoiders are not just passive, but what we just saw in the state of Arkansas was wealthy school districts just challenged and got overturned the ruling for equitable education statewide because they did not want to pay a higher share of taxes to support statewide equality of funding for education in that state after a decade when that fight had been fought. So avoiders can be very active in their strategy to preserve a set of rights and privileges for a few at the expense of those who count on the safety net.
I'm going to say one thing about that. I mean, it seems to me that there's this picture that we have from the 1980s that poverty is something that is the result of a dysfunctional, underclass, and it's this small group of people, and if only they would behave better, that problem.
It's a moral failing.
Yeah, that problem would go away. And I think one of the things that we see coming out of this recession, and there was an article about it in the New York Times last fall. If you look at the poor and the near poor are going up and down, or they're just above the official poverty line. And these are all people who are likely to have to access government benefits at some time. That's a third of the American population. You know, our middle class is now an elongated middle class, and it has a bottom. And that this idea that need and opportunity, needing to think about opportunity in a broader sense is just for this small group of people, I think needs to be reframed. This is not a small group of people, but that we need to think about people who are exiting from the public sector, which is essentially what some of these avoiders do, and we don't want to be part of the needs that the rest of you have. But that it's not a small group of people, and that does have political implications for reframing what the issues of providing opportunity are. It's not some set of dysfunctional people who aren't behaving properly. It's a lot of people who are suffering from the kind of jobs our economy is creating. How do you get back in after a recession? What kind of public schools do we have? And that's a much broader problem that encompasses a broader set of people.
A lot of times when we think about avoider, you think of somebody that runs and hides behind the corner. But the avoiders are actually quite aggressive, and they're promulgating a lot of new policies that become models for other places. In the previous session, Teresa Cordova talked about the downward spiral of austerity. Well, there's also a downward spiral that's associated with that type of avoidance that can cause other municipalities to join forces and to push the very same policies that marginalize other families in the area, or try to cast out the poor. So I think we have to be attentive to both of them. In many ways, austerity and these new policies, they work together because austerity becomes a justification for this new round of policy making.
Right. So in the great tradition of Peter Sagal on Wait, Don't Tell Me, what I'm going to ask each of our panelists is their prediction for 2013 for the state of the safety net, what you see as what's going to happen. So next year when we have this panel again and we can see if our predictions have come true about the state of the safety net. So I'll give you a second to kind of think about what you see as the likely scenario that will happen either when we back away from the fiscal cliff or we are in free fall.
Well, that's what was going through my mind, the fiscal cliff, the pensions in the state. I mean, there's so much uncertainty that I find it hard to make a prediction with any certainty. It seems like there will be great need either way.
So I'm not going to argue with that, but I will. But my prediction is that in 2013 we'll be in a pretty chaotic state because many things will not be resolved, and there will be changes in the delivery system. There'll be changes in the amount of money available. There'll be an insufficient amount of information that people will be able to tap into to take advantage even of the services that are still there. So it seems to me that we will have a heightened responsibility to try to connect people with what is out there, even in a time when things are shrinking and advocacy is on tap for holding on to that or even increasing. So chaos, I think, is going to be the word of the day, a big responsibility to help people through that.
And because of the chaos, you're going to have this last line of defense, the food pantries, the emergency services, those community organizations and the family, they're going to be bearing the brunt of that chaos and picking up the pieces. And so I think it's going to be a difficult time ahead.
And I guess I would say a lot of 2013 is going to be about looking toward the implementation of the Affordable Care Act and hopefully looking for the, optimistic note, looking toward the opportunities that might present along with the need, the chaos, and the food pantries. But thinking of that and trying to find the opportunities that are there.
So our responsibility here, if any of these come true, we will find out about it next year for the UIC Forum. But I had threatened Lawrence Massal that we were going to rush his panel and make sure that the pension resolution was not at the expense of the safety nets. I need all of us to stand up and advocate broadly for the needs of those we serve. Thanks to our panel. Margaret's research, Nick, Julie, and Rachel. Thank you all for being very attentive here. We are dismissed.